a healthier life. This is Kara's Cures.
Welcome to the Kara's Cures show, where we explore the cutting edge of wellness for our mind, body, and spirit. I'm Kara Sundlin, and today we're talking about such an important topic for parents especially, because we want to protect our children's teeth. And as we approach the Super Bowl, you might be thinking a lot about your kids playing sports. Now we've got local mom and dentist here, Mitra Kabakoff, and she's talking about why there really should be a movement to require mouth guards in more sports. And what do we do if a mouth injury happens? You might not realize some milk is going to come in handy. I had no idea. I learned so much. So thank you so much for being with us, Doctor.
Thank you so much for having me.
So, you know, I've had the privilege of actually seeing you on sidelines, too, here in Connecticut, and, of course, asking different questions. But, I mean, if you're a mom and you've ever had a mouth injury, it's so scary. I mean, the blood that comes out of a child's mouth, you think you don't know what you should do.
Yes, it can look horrific. The good news is most things can be prevented.
Okay.
There are, of course, some freak accidents, but there are some things we can do to help prevent these injuries. The first and foremost is wearing mouth guards, just like other protective gear that we wear, like helmets, face masks, that sort of thing. So mouth guards really are an important thing to be able to use to help prevent injuries.
And you say we really should be wearing mouth guards. Our kids should be wearing mouth guards in more sports than are required.
Yes, so currently they're required in football, field hockey, ice hockey, and lacrosse. But really they should be in almost every sport. The popular ones, soccer, basketball, baseball, softball. We see a ton of injuries, and you know, kids are they're not mandated to wear them, so we find that they're really not being worn.
No, I mean, I think it's hard enough to make my kids remember to wear the mouth guard in the sports that are required, but it seems like it would be a tough sell to make the child wear it when the coach isn't making them wear it.
Yes. So I think we as pediatric dentists, or as dentists in general, really have a way to be able to educate, change the culture, because you know a lot of these coaches, like you mentioned, parents, coaches, they just don't really understand the benefit.
Right.
You know, and that's the first and foremost, is to really educate people. And then just changing this culture of, you know, it's becoming like, okay, this is what we do, rather than being the odd few, you know, who are wearing them in these sports.
I mean, once upon a time, seatbelts weren't required, and now most of us couldn't get into a car without thinking about putting it on. And that's really almost just a one-generation change. I mean, my husband came home in the hospital, like, on his mom's lap in the front seat.
Yes.
So, you know, it really, things can shift. What do you see in the office? So maybe us moms on the other side can know why this is important. What kind of mouth injuries are you seeing from not wearing mouth guards?
Yeah, so I see a lot of things. The most common things are lacerations, teeth fractures.
It's like a
broken tooth, yeah, where like the nerve is exposed, teeth are being shifted, they're moving around. And the worst possible scenario is a knocked out tooth, where it's completely knocked out. And I have seen that also, unfortunately, where you know the kid has walked in with their permanent tooth in the palm of their hand.
Which I just learned that if this happens, I hope it never happens to you, but if your child's tooth is knocked out, there's something we're supposed to do right away.
Yeah, so time is of the essence. That's a huge determinant in the prognosis of the health of the tooth. So we want to keep it from drying out. And if you are at a sporting facility, a lot of coaches have something called Save a Tooth. It's a special solution that'll help preserve the cells of the tooth so that the tooth doesn't dry out. If that's not available, milk is great. And worst case, you know, you can keep it in your saliva on the side of your cheek. You just basically don't want it to dry out, and you want to call your dentist as soon as possible. Studies show that if the tooth is reimplanted within the hour, the prognosis is much better. After that hour, the prognosis really declines.
Oh, so you got to rush.
Yes, you have to
rush. Do you go
rush.
To the ER, or do you call the dentist?
Call your dentist, yeah.
Don't go to the ER, call the dentist.
Yes.
And there'll be even if it's on a Saturday, there'll be an emergency line? Okay.
Yes, of course, first make sure, you know, the overall body is okay. If they had a concussion, if they're, you know, we want to make sure they're physically okay. But once we know that, call the dentist.
What if they need to go to the hospital because of other things like a broken bone? Can you ask them in the ER to put the tooth back in?
Yes, there are residents, most hospitals. I know at CCMC they have the Yukon residents that are there. They take calls. So there's always, and at Hartford Hospital, the oral surgery residents, or they have the hospital residents as well.
Okay.
Yes.
So the other thing that I learned that I never knew from you is that wearing a mouth guard can actually help prevent a concussion?
Yes. So wearing a mouth guard really, not only does it help the teeth and, the dental trauma, orofacial trauma, but it can help to soften the blow. It's like a cushion, so it takes, especially if there's a blow to the jaw, it can really help redistribute the shock. And without that cushion, sometimes when you're punched in the jaw, those forces can actually travel to the skull and cause concussion. So wearing a mouth guard really can, in certain instances, prevent concussions, or maybe they're not as bad.
Okay.
Yeah.
I mean, as someone who, my son plays football, and he recently had a concussion, and I think he was wearing a mouth guard. I hope he was. But he's definitely that kid who always forgets the mouth guard. And then we've got this extra one, in the pocket that's probably not even molded yet, and then we have him wear it or something. And that's not great either. The fit matters.
Yes, the fit matters. So there are different kinds. There are three main kinds. There are custom ones that are the best fitting. These have to be made in the dental office. So the dentist makes them. You can either do the traditional alginate impressions. They're a little messy, but they work fine. In my office, I have a 3D intraoral scanner, which is great. It's quick, it's not messy, it has a more accurate fit, and they are just more comfortable. They fit better, so the kids tend to wear these better. The downside, another plus side, is that they're digital, so they're stored. So if your kid is someone who's constantly losing their mouth guard, we can quickly make them again without them having to keep coming into the office. The major downside with these is the cost. These fit the best, but they tend to be the most costly.
About what would they cost?
It really depends per office, but a few $100s typically. Yeah,
so
the lab fee.
If you have a kid playing multiple sports, it might be a good investment because you're trying to protect their teeth, which it's not inexpensive either if you get a tooth knocked out.
Exactly.
But and again, it may be of an FSA. But what would be the idea of them wearing that? How long would they get out of it? If you have a 14-year-old kid, will they be able to wear it for a long time?
Yes. Once you're in permanent dentition, so all of your baby teeth are gone and you have the full set of the adult teeth, you can get years out of this mouth guard. Yes.
And are the repeats less expensive because you already got the scan? Or no?
Yes, the lab, just the lab fee really at that point.
Okay.
Just
because I would be I'm sure I'd be a repeat person. But if you're not going to get the, I didn't even know you could get custom mouth guards.
Yes.
But if you are not going to get a custom mouth guard and you're going to the store, what should we look for?
So the second kind is like a semi-custom boil and bite is what they're known as typically, and you heat the material, you mold it to your teeth, and these are great too. They're especially a great option for younger kids who still have baby teeth that are kind of loose, falling out. That way you're not changing it constantly, whereas a custom one is pricey and it's not something you want to do every 6 months or so. So those are great. You can find those at the sporting stores. You can find them online. And those are great. And then the third option, which is the least protective, but it's still better than nothing, is the stock ones. And those you cannot mold. You kind of just have to bite down on them. They're a little harder to talk, and you just kind of bite down. And those are great, though, for people that have braces or other dental appliances. Those are a good interim mouth guard to use.
Okay.
Yes.
So braces also present a problem because it makes it uncomfortable.
Yes.
But if you're not wearing a mouth guard, is it even more dangerous because of all that metal in your mouth?
Braces, in a way, sort of are protecting.
Oh, they protect.
Because the wire's there, so it's less likely your tooth will completely be knocked out with braces. But it's still better to have that extra layer of cushion, for sure. Yes.
If you have lost a tooth, what does a child do? Is it the same as an adult? Do they make an implant, or what happens?
Children, so if it's a baby tooth, we don't re-implant it because you end up doing more damage to the adult tooth that's growing underneath.
Yes. But if it was one of the adult teeth?
If it's one of the adult teeth, absolutely. We re-implant it, hopefully it's within the hour. We reimplant it, we splint it and for a few weeks, and then take the splint off, and we just keep our fingers crossed. We monitor, we take lots of x-rays and testing, make sure the nerve is healthy. In cases where, the prognosis of the tooth isn't great, patients end up losing those teeth later on, then they're candidates for implants. Implants are typically more for once you're kind of done growing or later teens. It's not something we would do on a younger child.
Okay.
But definitely there are options.
So would you advocate that all sports should have mouthguard, like even like tennis?
Yes. So my kids would roll their eyes. I want to put them in a bubble all the time when they're skiing, when they're, you name it. They're like, oh, Mom,
Yeah.
But the American Dental Association actually currently recommends mouth guards to be used in 92 different sports and activities.
Really?
Yes.
Nobody tells us that when we go to the dentist.
And surrounding states like Massachusetts, New Hampshire, and Maine actually have passed, they're spearheading, leading the way. Soccer and basketball, in those states, mouth guards are required. So
really? So
yes.
Massachusetts, if you play basketball in Massachusetts, you have to wear a mouth guard?
Yes.
Wow.
Yes.
And I've seen it where, my son used to play basketball. I mean, it can get quite aggressive when they're trying to get the ball away from each other.
The elbows. People falling on top of each other. Baseball is another huge one. I see so many baseball injuries. And it's
from
not
the ball?
It's not a contact sport. It's not one you would necessarily think. But it's so common from the ball. People just aren't paying attention, and those can get pretty bad.
Yeah.
So
okay.
those, but if you ask me, I would recommend it for everything, any kind of sport, especially the contact sports.
Okay.
Yeah.
Now, I'm going to go even like girls. My daughter danced forever. I'm trying to think, would you ever need a mouth guard for dance? And it would look weird. But so something like that, you might be okay.
I mean, something like that, I think it's, that it's
you're in a line and someone could kick you, but,
exactly.
but in general.
Not as likely,
But some sports that we're not thinking about, like if you're a mom sitting here watching this, where do you think we don't understand?
I think, even in these sports where they're required, I think just the culture, it's so frustrating because a lot of times, and my kids play a lot of sports, there are some teams that even though they're mandated, they're allowing these kids to come on and still play without mouth guards, and it's just so frustrating.
Yeah.
My kids will listen to the coach rather than listen to me. So I wish it was in all these sports, but really, soccer, basketball, softball, all of these.
You're seeing trauma in all of them.
I'm seeing lots of trauma. Yes, trampolines, skiing. Skiing.
How are you going to knock your teeth out of skiing?
I mean, unfortunately, way worse trauma. But you fall, hit a tree, or you're maybe not the best skier, and people are running into you, falling. It's like that. Yeah, so it's hard to draw the line, but
so 92 different sports. We're not going to go into them all the way here, but right now in Connecticut, the only ones that are required are.
I think it's football, ice hockey, field hockey, and lacrosse.
Okay. Yes, my daughter has to wear one for field hockey, but again, now what about? I've seen it in high school a little bit different. As a younger kid, you're hoping you remember the mouth guard.
Yes.
But I've seen my daughter's bag sometimes. I mean, it looks like a chewed up Starburst. Like, how is this going to protect you? She's like, I like to chew on it. So we also need to replace them a lot?
Yes. So if you see that they're worn, yes. It's funny you say that. I was just watching my son play basketball game last week, and I asked him after, I was like, were you chewing gum or were you wearing your mouth guard? And he has a custom one. So yes, they chew on it. I think sometimes you watch, these college kids and the pros play, and they're chewing on their mouth guards. It's like a thing. But yeah, if you see signs of wear, definitely you want to replace them.
Okay.
And they're different ones, so the custom ones are really molded to your teeth. They can make them nice and thick. There are lots of different brands at the store, so some are thicker, some are thinner. It's like hard to, they're not all created equal.
Okay. Now, what if in a pinch you're just wearing your retainers, those plastic shields that you wear to keep your teeth after the braces, or a mouth guard that you wear at night? Does that offer any protection?
Absolutely. It's still better. It's not cushioned so much, but it's still at least keeping the teeth any trauma to those teeth, at least it will help prevent them, hopefully, from totally being knocked out.
Right, and I mean, more and more people are doing Invisalign, even for kids, which I never did because I knew, like I said, I have a kid who loses things.
Yeah.
But if you are wearing Invisalign as a kid or a teen, do you need to wear the mouth guard over the Invisalign?
No, you can just wear, I mean, normally you're playing a sport for a short amount of time.
So take the Invisalign out and wear a real mouth guard. So don't just be like, I don't need it, I got my Invisalign in.
Correct. And the mouth guard kind of does both. It's molded to the teeth, so it's keeping those teeth, they're technically not moving in that hour or 2 hours, whatever, practice. And it has the cushion, so it helps protect.
So what would it take? You said, and I didn't realize this in Massachusetts, they've already passed. Are they laws? Are they regulations? Are they just advice? Or
I don't know, to be honest, how, I didn't dig too deep. I've heard recently that these few states have managed to, and I don't know if it's mostly at the high school level, or is it across the board. Of course, as the kids get older and more competitive, the injuries you tend to see more at the high school level.
Yes.
But yeah, that's a great question. And what do we need to do to kind of get that here? We want to educate, and I don't know where that starts. Does it start with the coaches? Does it start with the officials? And trickle its way down? I think it's how it's presented. A lot of times they don't have the knowledge. They don't really understand the benefits.
Yes.
So it's the culture. Like, they don't pass it down. The kids don't realize how important it is because the coaches themselves don't always realize,
right. I mean, we grew up when you didn't wear helmet skiing, and so the idea, so it probably needs to, but interesting, Connecticut, Massachusetts, we tend to be a little bit more forward in health department things. And we've done other things, right? They managed to make breast cancer requirements different. We all need to know, women need to know if they have dense breasts. So we might think this is no big deal, but what you see are injuries that not only could be thousands of dollars, but can cause lifelong problems. Like, what type of complications could happen?
Yes, so we're seeing, actually, it's a great point, because the implications are many. It's not only the pain of the actual in the moment, but there are lots of psychosocial effects that are long-term and economic implications. With a knocked out tooth, we're talking the splinting, the years of temporary maintenance, implants, crowns. The list is long, and these poor kids who will always have to worry about is my tooth okay? It's something you have to constantly think about.
Yeah, it's not like a broken wrist is going to heal in a couple months. It's not that you want that.
Right.
But once that tooth is gone, it's gone, unless you were lucky to get it implanted right back. That time is important.
Yes. So, and having something plastic that can potentially prevent this, it's almost like a no-brainer.
Right.
Why are we not wearing this?
Yeah. Does it matter when you're going to, say, Dick's and buying one, which brand, or some are like super trendy and expensive because the famous football player is wearing it, or there's the other ones that are flavored. If your kid we just get the one your kid will actually wear.
Yes, it's like toothpaste. I always tell people, it's whichever flavor that, if it's going to make them want to brush their teeth, or if they love an electric brush with a character on it, have at it, whatever works. So different ones. Shock Doctor is a pretty popular one that they have at Dick's and other sporting goods stores, and they have the flavors. And sometimes even as a dentist, I go in there and it's overwhelming, the amount of choices. I'm reading like, wait, which one? I think there's some great marketing
right.
going on.
Let the kids pick it and be excited about it.
Yes.
I mean, this would be my tip for moms: buy two and then boil both, because they lose them, or they get out to the field and they're not. I mean, normally you're just thinking, oh, he's not going to be able to play, and that's the big thing. But really, what you're saying is nobody should be playing a lot of these sports.
Yes.
Fair to say, I know you have 3 kids. Do they wear mouth guards in sports so that it's not required?
They were better at it when I was at every game on the sidelines. I didn't want to embarrass them, but I would always stand there, and I didn't want to shout across the field, but I would, call out their name and like point to my mouth, and they knew, they'd take it out of their pocket. And like I said, I was just at a game last week watching my son, and it was debatable if he was wearing it, and he has had trauma to his tooth at school, not on my watch, but Yeah, so even a dentist's son still thinks he's invincible. And it's like, oh, we fixed the tooth, it's fine. So it's definitely,
Yes.
It's a work in progress.
Well, you know what? Our kids, especially teenagers, they're so invested. I mean, we've done stories on teen girls spending way too much money at Sephora, TikTok,
Yes.
all the trends. But
Yes.
all the money that they
Yes.
want to spend on whitening their teeth, that's a whole nother story, whether kids should be doing that.
Yes.
But the idea that actually I don't know that most kids realize how this could really impact the way they look for the rest of their life if
Yes.
they lose a tooth. My father lost 2 teeth, the front ones, in a football accident. And I never really knew it until, like, one time his bridge broke. And I'm like,
Yeah.
you don't have teeth? And, like, it was like a couple of days before you get into the dentist or something.
Yes,
So he just had to
yes.
not smile. But
Yes.
he's like, oh, they've been gone since I was, like, 21. I'm like, what?
Yes.
But so this is a lifelong
It's
thing.
a lifelong thing, and like we said, not only the immediate pain, but just the economic implications and psychosocial. A lot of these kids,
They're not going to want to smile. All the selfie generation, they're not going to like it if they don't have good teeth.
Yeah, and I think the attitudes are shifting. Like, for example, when my son had that injury, it was in 3rd grade. And I remember our neighbors saying, oh, he's a boy and that's what happened, oh, you're like, this is just kind of what happens. And I think that the attitude is slowly shifting. Like, these things can be prevented, and just because they're boys or girls and they're playing sports, it doesn't mean that we have to have these injuries.
Yes.
Yeah.
So I want to also ask you, as long as you're here, we'll get a little free advice about some other things.
Yes.
But let's say you have a mouth injury, and we know mouth guards could be super important. Maybe you could show this to your kids, and they'll want to wear it a little bit more. I think ultimately you're right. Raising awareness, hopefully, shows like this would maybe hope at the government level or at the CCIC level, where sports governing bodies. But let's talk about what if, in addition to the tooth, something has happened to the face. I have also done stories where a plastic surgeon told me, don't go to the ER. They are not plastic surgeons.
Yes.
Go, call. And it's not like your kid has a plastic surgeon on speed dial, but
right.
It's better to call an emergency plastic surgeon to do anything on the face. Is that true?
Yes, that's what I've heard. I think at CCMC they don't have plastics. They do at Hartford Hospital, but I know there's all the politics where, they won't, at Hartford Hospital, they won't treat under a certain age. So yes, call definitely a plastic surgeon. Yes.
I learned that with my daughter, who got a scar, but would have been, it's actually much better, but she, some kid, they all got trophies for winning something, and they were jumping them down their trophy, and the wing of the trophy went right through her eyebrow. And thankfully I had done that story, but otherwise I would have taken her to the ER. And instead he said, no, you were right, because this is, pretty obvious. It's right along her eyebrow down to here.
Yes.
And I was so happy I knew that. So I want to share that with everyone watching, that even if you don't normally have a plastic surgeon in your life, they'll treat you in an emergency if you call and say, I have an issue.
Yes.
So maybe, I guess you just look up, ask a friend, whatever, but we do have a lot of local, I use Dr. Paul Stanislaw in Avon, but
he's great.
Yeah. So there's, and he came in, it was not his normal time, but a lot of us think that we can only go to the ER, and what you're saying is, bring that tooth, get to your local dentist, because waiting for in the ER for a couple hours, you've just lost your tooth.
Exactly.
So call your dentist. Even if it's after hours, they'll likely come in for you.
Yes, absolutely.
Keep the tooth in milk.
Yes.
In saliva.
Yes.
Or in Save a Tooth. I didn't even know that existed, but I guess your coaches might know.
Yes. I've seen it when my kids have played. The coach will have it in the bag, the trainers. Yes.
So Mitra Kabakoff is a dentist locally in Farmington. Now, if someone's not even your patient, but they want to just come in for one of these custom mouth guards, can they do that?
Yes, absolutely.
And is that the case with most dentists? If you call your pediatric dentist and they don't do it for some reason, you can go somewhere and get it done?
I would think so, yes.
Okay.
Yes,
all right.
absolutely.
So it's something, gold standard, Lamborghini standard, you're getting the custom. If not, make sure you have a few of those mouth guards around. Maybe put them in all of their bags so they get there and they don't say, oh, I forgot it. And not just at the games when the ref is checking. You want them wearing it during practice.
Absolutely. Yes, that sometimes I hear, oh, Mom, in practice.
No one's checking.
Yes, or we're not really, in football, it's just practice. We're not really tackling. And
right, except You know, a lot of, right.
You never know.
And soccer, it's so interesting to me. You say soccer, you're seeing a lot of trauma.
Yes.
How does that happen?
That's actually the one and only time I saw a girl walk in with her tooth in her palm of her hand was from a soccer injury.
From the ball? Or?
Her knee or someone else's knee. I think she was a high schooler.
Oh.
And the knee hit up and the ball hit the tooth. And it was when I first, this was like almost 20 years ago, when I first started seeing patients, and it was traumatizing for me as well. You know, things you read about and you didn't think would really happen. But it is possible, I will say. Well,
as we talk about the Super Bowl and everything, this high level of competitiveness with everybody now doing club teams and practicing so much longer and more hours, and the level of play is leveling up, so you're seeing more mouth injuries also.
Definitely. We're seeing like 54%, I think, of kids between the ages of 6 and 18 are now playing sports, so more than half, and 31% of injuries are happening, dental injuries are happening while they're playing sports. So
about a third of every injury to the mouth is happening because you're playing sports.
Yes.
Or, in my house, it was because, someone fell down the stairs or something. Okay, before we run out of time, what's totally unrelated, but we're trying to keep our kids' mouths healthy. What do you think about all the charcoal toothpaste and the whiteners and everything they're doing on TikTok? Is any of this dangerous?
No, so the charcoal toothpaste is not great. It's actually, it's abrasive, so it starts to remove the outer layer, the enamel on your teeth. It's not great. The whitening, some of them are abrasive. And to be honest, whitening toothpaste, it's not on your teeth long enough to really work. It has to really stay on your teeth for a while for it to actually whiten. So when you're just brushing for a minute or so, it's pretty gimmicky. Okay,
is it okay for them to use the Crest white strips and things?
The Crest white strips are a great option.
It's okay, even for a teenager or kid who's like, I want my teeth to be white?
Yeah, those are milder than the in-office treatments. The in-office ones that the dentists, the professional grades or professional strength bleach is much stronger, so that's not a first line offering. But for the teens, I recommend the Crest white strips, and oftentimes they'll do it once or twice. They're good to go, and it's fine. You just don't want to do it repeatedly.
No charcoal, Crest white strips are okay. Wear the mouth guard. Dr. Mitra Kabakoff, thank you so much. I learned a lot.
Yeah, thank you for having me.
Who knew? Mouth guards help prevent concussions. I hope you've enjoyed this CURES, and you can follow me at Cara Sundlin for more information on the cutting edge of wellness. Have a great day, everyone, and be well.